Hmm.
Hello, everyone. Let's welcome All India Rank 367, Dr. Anurag Nanda. Congratulations once again, Dr. Anurag, for this achievement in NEET MDS 2026. He is a BDS graduate from GOVT Dental College, Lucknow, Uttar Pradesh.
Congratulations, Pete.
Thank you so much, ma'am. Thank you
And
so much, sir.
very good rank, very good rank. And it
Thank you,
shows
ma'am.
your hard work.
Mhm.
So tell us, how has your journey been? Like how it started, why MDS you wanted to do, what was like your driving point, and how you prepared.
So I started my journey in my internship also only. This was my second attempt. During my first attempt, I scored an all India rank of 620.
Mhm.
So I was almost there, but just missed the
Yeah,
mark.
just
So
missed.
yeah. So I was so confused to whether start again or go for the college which I was getting. So I was
Mhm.
in little dilemma. Then I contacted sir, and sir only told ki you do what your heart says. So I guess that was the most important point. Ki why I want to do this again? What will
Mhm.
drive me further? So these were questions that were important to be assessed at that time before starting the preparation, because that was the main motivation that will hold you in the journey during the preparation. Because 1 year, because this preparation was, I was in two phases. So during my internship attempt, it was very much with college. I was enjoying participating
Mhm.
in co-curricular activities and was also studying. So that phase was like very much enjoyable, but sitting at home and only studying without joining any clinic or anything was totally different. So I guess I have lived both the worlds and know कि, yeah, this is
So after
what my
living
journey was.
both the worlds, like Dr. Anurag, आपको क्या लगता है कि how easy or how tough is the second phase of your preparation?
Second phase is a little bit tough, staying at home, because I don't know how you utilize your time. Sometimes you means when you have a lot of things to think about now, you just sometimes drain yourself into very negativity. So I will suggest, if anyone is like very ambitious and is preparing during his or her internship attempt, that attempt is the best attempt. Like if you can give it like your best, like 100% during your internship attempt, that favors you a lot, because sitting
Mhm.
at home and doing is like a different journey altogether. But yeah, it takes a lot of effort once again to start again and do things,
Mhm. Yes,
and
agreed. And
also yeah,
what
to
about
stay
the
motivated.
pressure? Like Dr. Amit always says, boys have a different kind of pressure. कि घर
No,
पे ना
ma'am, it
different kind है. What is that different kind? I want to know from you.
I guess it's the pressure, because I don't know. It just feels ki like the best blessing, if someone will ask me at this stage, is getting up and going to a place to work. What a man like can dream of, not money, not family. I don't know, but the best thing is like you just get up and you have a place to go. So
Yes,
every
very
man, I
true.
guess, wants the same. Like first, he
Very true.
wants to build that place where he can go and do some work like which he truly wants to do. So I guess
Yes.
that's the
Even
first priority
even
of
for
every
a
man.
girl, I think, Hannah, it
Definitely,
is
ma'am. Yes.
important for both. For all of us who are studying to become something, that is the thing, to get up. Very nice, yeah. कितने समझदार
Mm.
बच्चे हैं.
So
नहीं
this
नहीं
is a
मैम,
part of
वेलकम.
my orientation when I take session in colleges now, like what after BDS wala especially. You won't believe I tell them one line, like you will realize the day on the last day of the internship, the thought will start coming कि कल सुबह कितने बजे उठना है, क्या करना है, उठ के तैयार होना है या नहीं होना है, कहाँ जाना है, that is the biggest question. If that question is taken care of, like you said, in internship only, अगर
Mhm.
internship के साथ ही rank आ जाए, selection हो जाए, then it is all sorted. Otherwise, yes, it is not easy what you have done,
It's a
Dr.
problem.
Anurag.
Yes.
And that too with a very close rank of 620 last year, studying again, studying from scratch, and that too facing the difficult times, difficult paper like this year.
Mhm.
Yes. And Dr. Anurag, I've been getting many calls. Ma'am, my rank is 800 right now. And if I prepare, I'll go behind. And this year we have seen people who were at 800, 700, 1700. They've gone to like 2000, 3000. So first of all, do you tell me why do you think this has happened? This year especially. And what,
Ma'am,
what can be done to prevent it?
Ma'am, I guess this year paper was a bit different paper because I have given NEET PG last year also.
Hmm.
Ma'am, till last year, if anyone will ask me ki whether INI set questions are important for NEET or not, I would have said no because rarely they would have asked any one or two topic from INI. But this year that completely changed. The paper has topics from INI set also, and there were lot of conceptual based paper where very tricky and mostly from the dental part tricky questions were asked. So someone who have like studied in a more conceptual manner, that would have helped them to increase their rank, while someone who was just doing synopsis, because there is a thing like which is very popular that you said you should mug up all the synopsis, you should mug up all the dental pulse question that goes around, and many times it helps. It is the reality. Sometimes you just get a question that you have memorized it, so sometimes it favors, sometimes it like doesn't. So that was the jump in the ranks that we have seen. And
Hmm.
also with the increasing sources, resources that we are getting nowadays, that we have availability of more advanced resources. Students are using AI and to make questions and different things. The young generation has always got their own methods.
Hmm.
So that has also pumped up the competition, because
So
if you
did
are
you
staying behind and
use
following
AI?
the
Huh.
conventional methods, and you're fighting with the youngsters, so you will have always to have
Yeah.
You
think.
are also young, like why you are like
No,
not considering yourself? I
no, no,
hope you had
definitely not
also,
so
you
young,
must
my
have also
juniors.
utilized some of the resources of
Yes, ma'am.
AI.
Chat GPT and all that.
Yes, sir. Yes, sir. Mostly to frame questions, like to enhance the PYQs which were asked, to make something new out of it. Because
But
after solving pulps, sometimes it just becomes.
becomes very
Yes,
less.
ma'am.
नहीं, but I'm trying it यार, मेरे से तो इतना easy question बन रहा है. I don't know, my chat GPT thinks I am more intelligent.
Ma'am,
It's
actually, it
making
is
such
based
easy
on the
questions.
prompt that you type in. It's all about the
Okay.
prompt. So you will have to tell him that you want some moderate, hard questions, and on the pattern that was asked for NEET PG, and then it makes some good questions. Mhm.
Now, very smart strategy. I think third or fourth student who's telling us
Yeah,
this.
definitely.
So, what did you
Ma'am,
used to do? हाँ, बताओ अनुराग.
I am
no,
more
no, ma'am.
curious about the wall next to you actually.
Yes, even I am.
It's very messy. It's a whiteboard kind of thing which I have scrambled and just.
Can you just rotate the camera?
Doctors have white coat and white board. So I still have it. Can you imagine? I have two whiteboards. One is there in my bedroom, the other is there in my daughter's room. I still have it.
Actually, it is all about. Suppose I'm giving a test, I'm giving a GT, and there are some questions which I always do wrong, like always, always, like where the thyroid level C5 to T1, and I used to always
Uh,
forget it like every time. So I used to write those questions in the wall that I always see them in my front. So I always keep memorizing it, and it just helps me in some ways. Mhm.
no, it's good. It's good, Pete. And like Anurag,
So,
what? How when you gave the exam, like how was party? First.
ma'am,
Hmm.
party was relatively easier, except
Hmm.
five questions. There was like 95 question I have seen in some or other question or in some other topic, means I was very familiarized with it. However, few of them were tricky, but it was not like something that I have not studied in my like core.
Yes.
Like I had an idea about. Part B was a little bit tricky. Few of the topics I have never heard of, like in DM especially.
I don't know why
There
they're
were
giving
some
so
bouncers.
difficult DM. They're giving so difficult and new DM and ortho. Yet, how can we know? Like the MDS
Yes, ma'am.
people got to know it. Nah, nobody teaches those stuff in the college. So how are
Only
we
my
supposed to
basic
be
DM is
updated?
so difficult and like.
No, but part A beta only like our students are saying, and the students who
Yes,
have
ma'am.
got a very good rank, they are saying it was good. Otherwise, for whole of India, it was really bad. So,
Yes,
what was
ma'am.
your strategy, beta, for medical?
Ma'am, my strategy was to first, though, I used to listen to the lectures and I used to make my own notes of it. Then I used
Hmm.
to visit Pulse. So Pulse has two sections. One is the previous year questions and one is the basic questions that have been asked in very old exams, something
Old
like.
papers.
So my
Hmm.
strategy was ki jo, which are not the previous year questions, I used to only do them once. Like I used to solve them, and any new information I found in the explanation, I used to add them back in my notes. Like I used to give time to that. It took some time, but eventually I would like last day pe I will read only my notes, and those small bitty topics which were asked long back should be included in my notes only. PYQ I used to solve like many times, like four, five, six times.
Hmm. No,
Yes,
very good.
ma'am.
And you used to come for the quizzes and the revision
Yes, ma'am.
schedules that were given.
Yes, ma'am.
So
Yes,
आते
ma'am.
थे
Last year
question
also.
quiz में?
Yes, ma'am. Because it was a method of active recall. It like if you're
Yes.
just reading, you're just reading it ideally. But if someone is asking you something and you're trying to do a recall, it helps in a better way.
Exactly. But sometimes I get to, listen, okay, ma'am, please give me answers also. I'm like, by the time you're answering, I'm searching the new question. I don't have a list. Like, I open
Yes.
up the textbooks. There's like five, six textbooks in front of me, and then I search. Because every year, we have to add new questions. So, did you find this a problem? कि answer होना चाहिए quiz में भी?
No,
Or
ma'am.
you knew
Actually,
it?
many students were watching it in the recorded mode, so they wanted a
Ah,
clarity that what the
answer.
answer is
But I have
about.
limited time. If I keep on saying answer of 500 questions, it will be a class.
Yeah, then, ma'am, it could be done in a MCQ format or something where
But MCQ
a
format
tick mark.
में less हो रहा था अनुराग मतलब I was able to do
Mm.
less questions.
Okay, ma'am. Ma'am.
So what were the subjects which you feel like you were super confident during the preparation and the subjects which were troubling you initially? Then later on you worked hard or how you did overcome those?
Sir, during my UG preparation, when I was thinking of doing admissions, I used to always worry about PhD. Ki how I'm going to study biostats, epidemiology, like it would be my hardest. But I started my preparation with Manish sir's PhD, and he is amazing. Like I don't even believe that today PhD, I
Mhm.
guess, is my strongest subjects. I just love biostats and epidemiology. So I guess that was one of the things I was very confident with. Biochemistry and DM, I would say, sorry, sir, but that were two of my weakest subjects because they are very difficult to memorize and very difficult.
That's the
Always.
standard. Like
I was
if
very
I
happy.
ask 10 students which are their worst or most hated subject, I'm very sure 11 out of 10 will say biochem and DM. So
Even
I'm
I was
used to
very
this.
happy when he took over biochem and TM. He was telling me first, okay, you want to take biochemistry because, of course, medicine say I'm good at biochem. I said, no, 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 I will not
Yes,
take. I take only. So when he took biochemistry, I was very happy. Because see, with the problem with DM is nobody knows DM. मतलब
There is no one department of
the
faculty
prostho
like
will know
one
the
teacher.
prostho
yes.
portion, ortho will know the ortho portion. So that is one issue. So
Yes, ma'am.
DM,
It has a lot of things to just learn, and it just, matlab, you have
Cram.
to be very, yes, ma'am, be very thorough with it.
You
So
know,
I used to
yesterday I
revise a lot.
was taking one like for the new batch 26, 27 batch DM class. कल मैं ले रहा था composite chapter we were doing, and when we came to the name of the monomers and other constituents and all, one student said, "Is this a chemistry class or a composite class?" Like, जो भी है
Yes,
पढ़ना तो है, अब you can't help it. That's
for
because
your
in our
dental
UG, because in our UG days we used to study very differently. All our focus was from a chapter कि कैसे भी करके 5 या 10 marks question में इसको frame कर लें. But
Hmm.
for NEET MDS, it changes. Like you'll have to very aware of what you're studying. Like,
Yes,
yes, ma'am.
very true. So how was your clinical subjects, beta? All clinicals were very strong.
Yes, ma'am. Almost, yeah. Prostho a little bit. I was not very confident with, but other than that, yeah, I was very okay with all the subjects.
Dr. Anurag,
And
you
ma'am,
really made an effort sitting out at home after 620 rank. What was a typical day in Dr. Anurag's life? Like how many hours? What was the
He used to
planner?
get up,
And
what
what
exercise.
kept you going? What kept you motivating? Was
yes, sir. So usually I used to get up and used to attend my classes, whatever was planned for the day. Then I used to revise my notes and solve MCQs and all. I used to use the timer. That is a. I will show you. This is a kitchen timer
stopwatch. Okay.
used
Yeah.
for bakery. Yeah.
Okay.
So I used to set 40 minutes slots, and I used to set those 40 minutes and used to study and then used to take 5 minutes break. I used to do as much as slots I could do for a day. Mostly 6, 7 hours I used to do daily. I tried to extend it to 8 and 9 hours by the exam was near. So
That's a good thing. So, what were the bad days like, Anurag? When you could not open a book, when you could not talk to anybody, getting into depression?
definitely there is a lot of bad days, ma'am. Every time you doubt yourself, ki kya hoga, nahi hoga. But eventually, bad days also you could always rely on videos. Videos help a lot. It's a very
Mm,
good way of passive learning. So the
mm,
PYQ videos which are there in the app, I used to watch them. Ki, because in NEET, the art of solving question is very important. Ki you
mm,
when you approach a question, you think differently. But when someone else approaches the question, they also think differently, and maybe they see a new parameter which you don't know. So that
mm.
always helps ki how teacher is thinking, how which buzzword should I catch when I see a paper. Because this year paper was all about being smart and being fast. If you are not
Yes.
catching buzzwords, whether it's red jelly sputum or whether it's on
Mhm.
question on kala azar, and also you'll have to be very fast with
You have to
buzzwords.
very
You see
fast.
them and you do the differential and you mark and move on, because there was no
Yes.
time in the paper to be ki
To analyze one
mark for
question.
yes मैं mark for review को भी review करने का time नहीं बचता. Like you will have to be very fast.
So, how
So,
many questions you did?
ma'am, 231 I attempted
Okay.
because last year I attempted 240, so I was like कि maybe थोड़ा ज़्यादा कर दिया. So I was like case here
कुछ
थोड़ा
तो
सा.
और अनुराग इस साल नहीं होता, what you would have done?
ऐसा सोचा था।
मतलब क्या
Yes sir,
हम्म।
करते
definitely
सोचते
so
सब
sir.
है?
हाँ सर, जब प्रिपरेशन कर रहा था तो ऐसा ही था कि कितना कुछ भी हो जाए, पिछली बार से रैंक बेटर करना है, बस यही था कि मतलब
हम्म,
620 से तो थोड़ा सा बेटर करने की कोशिश करनी है, और उसी के अराउंड सारा वो था. बट
हम्म,
ऐसा प्लान भी लेके नहीं सोचा, बोला कि उतना टाइम मिलेगा वो तो कुछ सोच ही लेंगे या कहीं कुछ कर लेंगे, और बट जो भी करेंगे
हम्म।
आगे भी अच्छा ही करेंगे, अभी तक करते हैं तो.
तो बेटा
हाँ.
620 पे strategy and your rank right now 300s पे strategy, what is the difference? What you added, subtracted, क्या किया?
Ma'am, actually, first of all, in my last preparation, I did not give enough weightage to the PYQs. I adopted PYQs at a very late stage. So the first strategy would be key foundation you should build with PYQs. So
Hmm.
during your lectures, live lectures you are watching, you should try to give PYQ equal weightage and add them in PY topics, PYQ topics. What are there? And then, ma'am, it should be more of solving questions, like new question. You try to just look up for the questions, ma'am. Even last year, 2 years of NEET PG, what they are asking in pharmacology. Ma'am, this year there was a direct pick in pharmacology from NEET PG last year. So they try to frame some questions from him. You also do, ma'am, sessions on last year PG questions also to help us. So that was the whole strategy about try
Hmm.
to.
Dr. Anurag, coming from a college which, like, unfortunately does not have a record of very high rankers in
Hmm.
NEET
Yes,
MDS,
ma'am.
but yes, your senior batch, Dr. Anshuman Rai, our student
Yes,
from
ma'am.
BBD 120 rank, now is in KGMC.
Yes.
What was the motivation force? Like, what drive you towards going into MDS, and that too, not coming back to a private college, but running or chasing a dream of government seat?
Yes.
Actually, sir, it is very important na, कि like when you see someone from your college or someone you know doing
It
something in life
helps a
na,
lot.
it just affects
Mm.
very differently
Many
from
lives
you seeing
actually. Yeah.
someone from paper. So when you see कि someone who have studied from the same library you are sitting, from the
Hmm.
same teachers, and he could do it na, he definitely makes a positive impact on you, and you think कि if he can do it, definitely things are fair and you can also do it. So definitely that
You saw
like
Anshuman's
tends.
interview?
Yeah, yeah. I
So
know
he
him
has
personally also.
similar wall and books, पता है? Background, even his background is almost same. Remember? His background is almost same in the interview.
Yes, ma'am. He was very inspirational and he used to
No,
like,
indeed he was. Indeed,
he was
indeed. Very good. So, what is one thing, Dr. Anurag, what message would you like to give to the fellow students of your college, private college, government college? क्या message? How to crack it?
I guess it's all about intent and good faith in what you are studying. And always preparation should start with why I am doing this or what is the motivation that will drive me all along, because strategies would be there some here and there. Some toppers would say this, some toppers would say that. But believe me, the simplest things are like the hardest to do, like daily viewing lectures, making notes, and for a long period of time, like 12 months. It's the simplest thing which you should be ready to. So start with commitment, start with following lectures and interacting with teachers. They will always guide you to a better path that we are all doing, we are all learning. So
And Anurag, you're very happy, and we are happy for your success with them. The
definitely,
happiness,
ma'am.
you
Same.
are having right now, even we can feel it. And we are very proud of you.
Thank you so much, ma'am.
You are at home. Can we talk to your
Yes, ma'am.
parents?
Yes, ma'am. Mother.
Okay.
नमस्कार
नमस्ते
मैम,
मैम।
नमस्ते।
बहुत बहुत मुबारक हो आपको।
बहुत बहुत मुबारक हो मैम।
थैंक यू।
और कैसा आपको
थैंक यू।
लगा जब ये आप मतलब पूरा जो परिश्रम ये बच्चा कर रहा है सफल हो गया, he got what he wanted.
हाँ
कैसा लगा?
हाँ, बहुत खुशी हुई, बहुत
मैम
खुशी हुई।
बच्चों से तो हम पूछते ही हैं कि साल कैसा रहा घर पर। आप बताओ
हाँ।
आपकी तरफ से कैसा रहा? आपको क्या फील होता था जब घर पे
हाँ,
पढ़
मतलब
रहे हैं?
नहीं, मेहनत कर रहा था और अंदर अंदर थोड़ा तो बच्चों को डर लगता रहता है। मम्मी पापा भी थोड़े डरे रहते हैं, लेकिन बच्चों के सामने शो नहीं करते हैं,
हाँ वही
तो
मैं
थोड़ा तो
जानना
डर
चाह रही हूँ कि मम्मी पापा को क्या लगता है जब बच्चे को वो देखते हैं, एक डॉक्टर बच्चे को घर में बैठे हुए,
हाँ
तो क्या फील होता है?
हाँ, थोड़ा सा तो सस्पेंस रहता है कि क्या होगा क्या नहीं होगा, थोड़ा सा तो डर लगा रहता है, लेकिन फिर रिजल्ट आया तो बहुत खुशी हुई।
हाँ
लेकिन
बस
अंदर एक विश्वास था कि हो जाएगा, अंदर से कहीं ना कहीं तो एक विश्वास था कि हो जाएगा।
वो बहुत जरूरी है मैडम पेरेंट्स के लिए ना, बच्चे पे
हाँ
विश्वास, तो बच्चा भी आगे
हाँ
उसको पूरा फिर
हाँ
खरा उतरता है।
उसने विश्वास किया है, उसने पूरा रखा है। बहुत
जी
मुश्किल है वरना करना जो अनुराग ने
हाँ
किया है, आसान तो
हाँ,
बिल्कुल ही
थैंक
नहीं
यू।
है।
हाँ बिल्कुल, थैंक यू।
कंग्रेचुलेशन वंस अगेन
Congratulations,
आप
ma'am.
सबको,
थैंक यू।
डॉक्टर अनुराग की मेन सक्सेस के।
थैंक
Thank
यू।
you so much, ma'am.
थैंक यू
Thank you so
डॉक्टर
much.
अनुराग फॉर योर टाइम।
थैंक यू बेटा।
थैंक यू।
जी,
और
बिल्कुल,
कुछ
ma'am.
कहना है
Thank-
आपको? योर स्टेज, योर
नहीं ma'am.
अचीवमेंट, एनीथिंग यू वांट टू से यू कैन से।
नहीं ma'am. Thank you to all the teachers who have in BDS to MDS who have helped me like for this.
थैंक यू बेटे।